So what am I talking about when I'm talking about minor adaptations and talking about rails? The basic thing is a stair rail, and that's called a mop stick rail, and this is a mop stick rail. Generally it's plain pine going up the stairs. The diameter of this is standard, it's 50mm for a good hand grip. It's also got brown brackets. Now these brackets, it will depend, and it's up to the technical officers as to how many brackets a rail requires. But if you can test here that the wall is hollow, they may need to put brackets in at quite close intervals, or they might need to put a backboard on here to make sure that the rail is safe. But generally you would expect the brackets to be no more than 900mm apart. The brackets are brown and the rail is this colour. We do not paint it. The client can paint it if they want to. We also don't put the client's own brackets on. If they're coming through to our service for a rail, we don't mix the two. So if they've got some nice shiny gold brackets that they want put on a rail that we're providing, we wouldn't do that. They need to do it completely privately. We would obviously be able to assist them in finding somebody privately. There's also something called the Newel rail, which is really good. It goes on a Newel post, particularly at the bend of the stairs, and the person can actually follow round with that. For outside, there's also the galvanised rail. This rail is used for outside. You need to use it for outside because it doesn't rust. One of the problems with this sometimes is that people find it cold to their hand. The only answer really for that is that they use a glove. But obviously if somebody's got sensation problems, that's not always the answer. But at the end of the day, it's an outside rail and it does get cold. Going back internally, if somebody has removed the banister rail on their stairs, and often this was done in the 70s, but now they've got older, they need a rail both sides, we can reinstate the banister. And we do this now with something like this. It's a functional thing. As I said before, we are here to do essential need only, not desirable need. We have to make sure that our budget is given to the most vulnerable and it's spent in the most cost-effective way. So although this might not look very nice, it actually would prevent somebody falling if you reinstated the banister. So we can do things like that. There's also the grab rails generally that you would find in something like the bathroom or the toilet. In Croydon, generally these would be our rails. They are white metal plastic coated rails. You would use this type of rail in the bathroom. You wouldn't, and in relation to electricity and static electricity, you wouldn't normally put metal in the bathroom, hence the plastic coating, and sometimes these rails are earthed. You wouldn't put a mop stick rail or a galvanised rail in a bathroom because of the dangers of that. People again, if they wanted to, can buy different types of rail, and also, as I said before about our guidelines, is people don't fit into boxes, and it could be that these rails, the diameter is wrong for them. Occasionally this happens, then therefore you need to actually consider, well, maybe we can buy something slightly different, and again the intake team will be able to help you with that. I'm holding a tape measure. Obviously this is something that you will need, and we usually use a metal tape measure. The reason for using metal is that it doesn't stretch, and a cloth one will stretch. So obviously we need to consider that we are working very closely with people. We can actually sometimes need to touch and get really close up And you need to be considering the male-female aspect. You also need to be considering whether somebody's given you consent to do that, and whether what you're doing could be misrepresented, misunderstood. Obviously, with males dealing with Asian females, with different cultures, you do need to actually be talking to the person and explaining exactly what you're going to do. One of the main things, particularly for this video really, is when we actually measure somebody's leg length. And so what I'm going to do is I'm going to get quite close to the person. I'm going to use my tape measure, and I'm going to measure from the floor to the crease. It's the popliteal fossa here. Obviously, if you've got somebody with long flowing robes like a sari or something like that, you may want to lift that sari to actually see where that popliteal fossa is. And again, I can't stress how important it is to make sure that you've got consent to enable you to do that. You see here, in relation to somebody sitting on a chair, that this chair is quite good. It's not saggy or anything like that. So you need to actually take into account when measuring that there's a sag in what the mattress or the chair. Normally what somebody would do is that what shoes they would normally wear indoors when sitting in the chair. So for instance, somebody may well be wearing slippers with a little bit of heel or something like that. So you would actually measure with somebody with their slippers on, or if they normally wear shoes or something like that, you'd actually measure with their footwear on. Again, you need to be aware of infection control, and it could be that this person has got weeping leg ulcers, and you're putting your tape measure quite close to their leg. Now you need to be considering about cleaning this tape measure afterwards. And should you actually be wearing gloves when you're doing this? Or have you got access to hand washing facilities afterwards? We will go into chair raising when we actually go through and measuring for a chair when we actually do chairs. But for the moment, this mainly is about how close we're getting to a client, about the infection control, and making sure that you get consent to actually touch a person.